Welcome to Stand Up for Doctors. I'm your host, Kim Downey. Thank you very much for joining us. This channel is dedicated to amplifying the voices of doctors, other healthcare professionals, and patients as they share their unique struggles, triumphs, and passions. My mission is to build connection and create advocacy for healthy doctors, driving positive change that benefits both doctors and patients. This is a space for everyone who cares about the future of healthcare. If you appreciate this content, please like and subscribe now. It really helps the episodes reach our target audience. And I would like to welcome Dr. Kemia Sarraf, and I'd like to welcome back Dr. Michael Hersh. Thanks for joining us today, Kemia and Michael.
Look at
Thank
Michael and I staring at each other. Which one of us is going to go first? I'll just translate what just happened there.
Okay, well, if this is a sign of things to come.
Certainly not. And I'll just say this is a tremendous treat for me. Two of my favorite humans in one place at the same time. And just so grateful to be here with both of you. So thank you.
Well, you're very welcome. And by way of introduction, Dr. Kemia Sarraf is a physician, public health professional, leadership development specialist, keynote speaker, CEO and faculty director, and adjunct faculty at SIU School of Medicine. And Dr. Michael Hersh is a full-time practicing gastroenterologist and the founder and CEO at Better Physician Life Coaching. And he's a trauma-informed professional coach, and he's my coach, and he's totally awesome. And today we'll be talking about how Kemia founded Lodestar in 2016, responding to a growing need for trauma mitigation coaching methods for physician colleagues who were reporting high levels of severe burnout, vicarious trauma, and moral injury. And in my speaking with countless physicians, trauma has been coming up, and it's one of my critical focuses this year to assure that physicians are able to connect with the resources they need. And I would like in this episode to hear from both of you more about the critical work that Lodestar is doing to support doctors. And I always ask, what would you most like our audience to know about you as we begin our conversation? And I feel free to include hobbies or anything. Kemia, would you like to go first?
What a lovely introduction. What would I suppose always the things that are least interesting are our professional credentials. So I will say that other things about me include that I am the mother to, I call them four semi-feral boys. Michael's met them all. He knows better. He would call them fully feral. Uh, I live on a small farm where we are active working farm and we love that a great deal. And I'm a storyteller. Yeah. Michael, how about you?
Um, I agree. And I think what's super fitting here would be I'd love to tell about how I met Kimia because I feel this is a really full circle moment for me. Because I met Kimia on a podcast that I had previously co-hosted called Doctors Living Deliberately. Um, the topic of that podcast episode was the trauma of medical education. And, I tell the story about meeting Kimia. Interestingly enough, we both did our training at the same hospital and we just did not overlap. Literally, she was completing the program as I was walking in the door. And so our paths didn't cross until the fateful day that she was a guest on this podcast. And I will say that Michael of years past would have heard the topic of the trauma of medical education and smirked, grimaced, rolled his eyes. Physician coach Michael, a little bit more elevated, approached that conversation with a little bit more of an open mind. But I guess I still probably wasn't fully convinced of what does it mean, the trauma of medical education. Um, and over the course, and this is still available for digestion on YouTube, you will literally watch my mind kind of explode as Kimia kind of talks a little bit about what the experience of medical education is and what medical careers are like for physicians and how trauma does play such a tremendous role. And after that conversation, I was so immediately drawn to the work. I immediately signed up for the trauma mitigation masterclass that's offered by Lodestar. And I had the great honor of doing that course on Kemia's farm, which, by the way, a sight to behold. And as Kemia and I were talking about recently, literally you pull into the driveway and just feel the immediate release that happens. So just have created such an intentional and amazing environment there. Um, and really, I have been all in on this trauma-informed work. So I hope that gives a little bit more of a background. I think Lodestar's mission and the work that Lodestar is doing is so incredible. And so I'm just so grateful to be a part of this conversation. And I've talked way more than I thought I was going to. And so
No, that's exactly what I was hoping you would share because I know that story and that's why I invited you both on today because I also fully know the value of it. So Kimia, what would you like to share either in response to what Michael said and or sharing a powerful story of your own? What's your why?
Yeah. I love that story, Michael. Um, Little do we know, right, when we go into some of these things, what we're stepping into. It's so interesting because while I was listening to the retell and it's I think the second time I've heard you tell that story, what I noticed came up for me this time was so different than the last time. Because what really came up for me this time is how I think some of the barrier that we bump up against as physicians when we start talking about the T word, right? Is that historically, it's certainly in our own minds, we view the approach as meaning woe is me. And there's no woe is me, right? I don't hear and I don't hear an iota of woe is me coming out of Dr. Hersh about what he experienced. What I hear is, oh, I see. That moment of awareness and clarity and naming of something appropriately and correctly. And, we talk a lot, well, we know this as physicians. If you don't have the right diagnosis, your treatment plan is going to be wonky.
Mm.
Your treatment plan could be harmful, in fact, right? Getting the right diagnosis is essential. And so it's really, really interesting. I'm sure all of us have had a patient at some point in our careers who we deliver a significant life-altering diagnosis to. Maybe not a fatal diagnosis, but one that is going to change everything for them going forward. And we watch them go, oh, thank God. Not because they're grateful to have the diagnosis, but because they are grateful to have a name for this vast array of symptoms. I mean, I'm an internist, so like everything is about, these figuring out what is the zebra. They finally have the right name for all of these symptoms. And once you've got the right name, then you can start to put your head around it and decide how you're going to navigate it. There's a point to this, which is that when I started doing this work in 2016, I really didn't start it to be, I didn't have line of sight to where we would be today, which is probably a good thing because Michael, honestly, I'm thinking the answer would have been no. 2016 me would have been like, ain't no way you can manage that, girl. I didn't have line of sight, and I don't think I fully appreciated what would start to crack open in our colleagues when given this context. That's also a good thing, right? Because I think looking back, had I known there would have been so much fear associated with that cracking open that I probably would have been like, oh, yeah, no, stay over here in your lane. What I've learned in the interim is that it's such a expansive, breathable space. So I'm going to say this, and I'm going to go back to where I was trying to get to. Michael knows I do this a lot, right? Around and around. One of the questions I think we get asked most often, and Michael, correct me if I'm wrong about this, is, listen, this sounds like therapy. How is this not therapy? You are not a therapist. To which I say, you are absolutely right. I'm an enormous proponent of therapy and therapists, and that is a subspecialty skill set I do not have. I am a physician and I'm not your physician when I'm in the coaching realm, right? So that is also very important sort of guardrails to set out. Now, the biomedical clinical model is that the patient or the client comes to us and we have the answer, right? We make the diagnosis, we lay out the treatment plan, we're having the answer for. Over here in the realm of, and that's true in therapy and in medicine. Over here in pure coaching models, quote unquote, big air quotes around pure. Over here in coaching models, it is the client has all their answers and you are simply there to, as an accompaniment, to ask the right questions. There has always been, as there is in everything, overlap in the Venn diagram, right? Between the therapeutic model and the coaching model, there is space, right? I am a bit more comfortable in that space because I'm very clear about what falls under therapy and I'm very clear what falls under coaching, that there's some oxygen in that, right? And we actively train ourselves, each other, the coaches that come through our programming, how to preemptively, so sort of foreground around what are the limits of my skill set. It is never you, the client, are so broken, you've moved beyond what I can do. It is, I am unskilled. I am unskilled in this. And I notice that there may be value in skills that I don't have. So that's how we really clearly delineate this. Now, when I went through my first coach training program, and that's a story probably for another day about getting tricked into it, one that Michael knows, but we joke about the fact, right? We have joked about the fact that when I first started learning about coaching, I rolled my eyes so hard they popped out of my head. Like literally, it was like, are you kidding me? And it was an absolutely transformative experience for me because what I saw in this very exquisitely taught coaching intensive I attended was that there was a whole skill set as a physician I lacked, an enormous skill set that I lacked, and that it would be beneficial for me to become skilled, professionally skilled in this way for everything. Better for, as a physician, better as a mama, better as a spouse, better as a human being, better in public health. So all of that sort of opened up for me. At that time, 2015, 2016, I had already spent more than a decade of my life building trauma-informed systems programs, policies, all of that, the education, all of that kind of thing. So I was very, very familiar, comfortable with teaching around what it means for an individual, an organization, a system, a process, a program to be trauma-informed. I bring this up because what I noticed happened wasn't I made an active decision, oh, I'm going to bring this into my coaching. This is how I'm going to coach. It was like breathing to me. It wasn't something I did or didn't do. It was just how I moved. That trauma-informed approach was just how I moved. So when I began coaching, the intent was just to have a very small sort of opportunity to work with colleagues that I could see were in pain. That was it. It was just so many of our colleagues were already in so much pain. Now we were starting to hear more and more talk about burnout. Trauma wasn't even on anyone's radar. I can promise you that. And so I began just having these conversations. There was also starting to be some really significant awareness around physician harm, right? In particular, self-harm. And the number of physicians who were dying by suicide was becoming more public. We were having an increased awareness of it. I don't know if the numbers were taking a steep uptick or simply we were becoming more aware. Either way, again, this was sort of entering into our awareness. As I began coaching, physicians who were coming in with deeply embedded shame and deep walls of pain about all the things, all the pain points that all of us carry. I'm not enough. I'm not enough. Right? I'm not smart enough. I'm not good enough. I'm not enough here. I'm not enough there. I'm not enough anywhere. This is Dr. Seuss book, probably, or the opposite of. What I really began to notice was that the symptoms that they were describing, and this is before, we had a ICD-9 code diagnosis for burnout even, the symptoms they were describing were identical to what you see show up, bubble up as trauma, as the, experience of the phenotypical experience of trauma. And because I just, again, naturally coach out of a trauma informed and responsive perspective, we're having some good success. And as that occurred over time and organizations began asking if this was something that could be taught internally within their organization, I do have a very high level of awareness of what I don't know how to do, which is I did not know how to train coaches. So I went back to the woman who trained me, Antoinette, and said, hey, what do you think about this? And I will actually never forget, because I was sitting in my basement and as I described to her, because I hadn't talked to her in about a year and a half, as I described to her what I was doing, I heard this like sharp intake of breath. And she said, oh my gosh, the thing you're describing explains so much to me about what I am seeing show up in my clients. Antoinette is not a physician, and she was not coaching primarily physicians. She was coaching CEOs. She did a lot of work in the financial sector. She says, this is what I'm seeing. You just described to me what I'm seeing show up in my clients. So she and I and Dr. Ann Deaton, who is a clinical neuropsychologist by training, turned coach, who's been in the coaching industry for decades, designed and built the first course for trying to train others to do it in this way. We met a lot of resistance. Met a lot of resistance from the healthcare field who are like, some bullshit. Coaching is bullshit. Sorry, can I say that here?
Well, go with it.
You can bleep me out. You can bleep me out. I'm sorry. I'll re-say it in case you want to cut it. This is inappropriate. And also resistance in the coaching field, right? The coach training field, saying, this sounds like, what do you mean you're talking about trauma-informed, trauma-responsive coaching? That is therapy, right? So it was a lot of initial resistance, and nevertheless, we persisted and continued to push. And then 2020 happened to all of us, right? And I think what had been under the water, and a lot of folks had been able to sort of deny or delay addressing, sort of rose to the surface. And it also rose to the surface for folks who maybe had never experienced this before, that level of toxic stress and the impact embodied of that level of toxic stress. So we often say that the field of trauma is fairly young in the history of the world. Trauma is not young, but our study of it is quite young and evolving very quickly, expanding very quickly. And so it's the working definition that we find is most useful comes from Resmaa Menakem, and he teaches us that trauma can be anything that happens too much, too fast, too soon, too long, which, okay, without enough. And that's really the key, right? Without enough of what should have happened and without enough of what we needed that would have resourced us. Both components matter a great deal. Both components matter a great deal because I can move through very, 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 very high stress if I have enough. And if I don't have enough resourcing, and resourcing is very broad, we can talk about if I don't have enough, right, then even moderate stress can land as toxic and harmful, as terrifying, right, as damaging. And it also takes us into that space where we realize, oh, that means that trauma is also quite subjective, which it absolutely is, which is why, right? Because knowing that it's subjective then could send us hiding under the bed. Because if it's subjective, then I don't know what any person is carrying. I don't know what any kind of thing I might do or say might harm someone. So I better just not do anything. Building skill in trauma-informed and trauma-responsive engagement releases all of that fear. Because what I've become skilled in is engaging with any person, no matter what. I don't have to know their places of harm, period. I just know that just like me, they've got them. Right? Not woe is me, just like me. Ooh, that was full circle. I told you I'd do it.
Yeah. Well, thank you for that really fantastic explanation. Kind of hit me in the gut as well as I think Michael can understand. And Michael, I'm wondering whatever you want to speak to what Kemia said, and also tell us a little more about Lodestar specifically and how it's benefited you and how it benefits physicians. And I have to say, Kemia, that I've seen every episode of Doctors Living Deliberately, and yours might have been first or one of the first ones, so I saw it. And right after that, that motivated me. I took a 3-day training with the Coactive Training Institute myself. So thank you. So you actually inspired me a couple years ago. Go ahead, Michael.
Um, I guess I wanted to kind of piggyback on what Kimia was just saying about um, okay, so first, trauma is subjective, which means that two people in the exact same situation can experience that very differently, not only based on their previous experiences, but also what are their resources at this particular point in time, right? So residency, for example, incredibly stressful. Fellowship, incredibly stressful. And I experienced those two educational experiences in very different ways because as a fellow, I had my experiences as a resident that were kind of informing how I was showing up. And I was a lot less resourced. And so, things land as trauma in us differently, just based on our experiences, based on where we're at. And it doesn't mean we don't talk about these things, as Kimia was just saying, because of how it could impact somebody else. One of the skills that I have learned, and it's part of the Lodestar container, is go backs, right? So we are so afraid of how something could land and what we say and the impact. And we always have the ability to say, oh, I just heard what I said, and that was not how I meant for it to land. Can I go back? Can I have a go back? Can I retry that? And it doesn't mean ignore what I just said, and it doesn't mean not taking accountability or responsibility for the impact of the words. It means I'm trying and I recognize it, and now I need a chance to say things the way that I want and really truly intend for them to be heard.
Hmm. Yeah, no, I love the way you say that. And tell us a little more about your work with Lodestar.
Sure. Um, as I mentioned, I did Lodestar's trauma mitigation masterclass, and then became a trauma-informed professional coach through Lodestar. And then actually started working as Lodestar faculty, going into organizations like Kemia was just describing, teaching these skills that she was saying she's had all of this pushback and challenge in creating, and then in real time getting to see the impact of the tools and the skills not only being taught but implemented. And the incredible journey that people are taken through over a 3 day intensive learning opportunity that really has been so incredible. And then I most recently have had the distinct pleasure of being a part of Lodestar's pilot True North coaching program, where I did a coach certification back in 2021 that was not certified through the International Coaching Federation. And Lodestar is now bringing forth an ICF certified coaching certification for physicians and professionals. And so I was offered an opportunity to do this work in an ICF certified coach program. And so I have had, again, the great opportunity to do that. And it's just been so phenomenal. I have learned so many incredible skills. And I'll also say that when I initially signed up for coach certification, I don't actually think I ever had designs on becoming a coach. Maybe I had kind of thought about it and I was kind of wondering, but there was this belief in the back of my mind, you're a physician, like that's just what you're going to do. Um, and so I did this work for me.
Mhm.
And in doing this work for me, I realized how important it was to have our voices out there talking about these things. Because when we can be out and talk, notice, and start to normalize how these things are showing up for all of us, that is actually the first step toward making things better for others, right? And so, I think my experience with Lodestar has been really transformative, and so genuinely have appreciated everything I've learned and all of the opportunities that it has afforded me.
Yeah, well, thank you for sharing. And this, I feel, has been a wonderful overview about Lodestar. And I feel like if you both have the bandwidth, we could perhaps make this a two-parter and get a little more and specifically and into some, nitty-gritty and immediate follow-up episode. But to wind this one down as a standalone, Kemia, is there anything else you would like to say specifically about Lodestar and also how our listeners can get in touch with you?
I don't know that there's anything more I want to say about Lodestar. In much the same way that I think my professional credentials are the least interesting thing. I also want to say that I think Lodestar itself isn't isn't the thing I want to center here. And I appreciate the opportunity to. I truly do. And if I were going to center something here, it would be the transformative nature of the work that we are doing together. Michael and I were just had the chance to be together to deliver a 3 day intensive, and we debriefed a little bit about this. I've been in pretty deep reflection, as you can imagine, Michael, because what we watched happen in those 3 days was a group of individuals who came in profoundly injured in a number of different ways. I won't say traumatized because trauma is not mine to assign to someone else, but certainly they came in injured and they also came in exquisitely guarded and doubtful. Okay. And that is very typical. Every single time we go to do this anywhere, we always have a certain percentage, if not the majority of the folks who walk in the room, very skeptical of the work. And what I felt we got to bear witness to over those 3 days was, and this is not too strong a word because we heard people say it and we received it in written feedback, absolute transformation. We sometimes talk about this work. The power of this work is that it returns us to who we meant to be, right? So often we hear physicians come in and say, I didn't go in to medicine to become this version of me. I don't know who this version of me is. And this holds true across a lot of different professions right now. This work that is intentionally designed this to take us from awareness to action. Also, as we do that for others, because that's who we are, it also transforms us. And I think that is a really powerful truth that sometimes we don't say because it sounds like snake oil sales. And we have seen it over and over and over. We have delivered the program I'm talking about right now is called Brave Leadership, and we have delivered it to more than 5,000 leaders across the country at this point. And we have seen it over and over and over and over again. This is incredibly powerful work. It's based in the neuroscience. It's based in best practices, best pedagogy. It's based in immediately actionable skills. And to the go back issue, which is such an important component, right? It teaches us how to actively release the fear of getting it wrong so we can be present to the people who need us to be present. We sometimes say that if I'm going to consent to teach in public, I better consent to learn in public, and that's what the go back is about. I will make mistakes. What do I do next is what matters.
Mm.
So that's, I think, the thing that I would really love to center at this moment in time. How do you get a hold of us? Lodestar, Lodestar PC, lodestarpc.com. All of our programs are dual accredited. Brave Leadership is dual accredited for 20 CME. We have the TMMC that Michael went through is 22 CME. Our True North Coach Training, 68 CME. All of us is 12 CME CE. This is on purpose, right? The coach, and because we want this to be valuable and actionable and accessible and meaningful for our physician colleagues.
Fantastic. Thank you, Kemia. And Michael, any final words from you and how our listeners can get in touch with you also?
Sure. I'll also just share, Brave Leadership. There is an open Brave Leadership. A lot of time these trainings are being done within organizations, but this coming July, August, there will be an in-person Brave Leadership training in Chicago that is open for the public to sign up on an individual basis. So you don't have to wait for Lodestar to come to your organization. And so that is also available at lodestarpc.com. You can get more information there. How many CME credits is that?
20.
20.
Open enrollment. Yes, thank you for that reminder.
So physicians, if you've got your CME funds for 2025, this is an incredible opportunity. And I'm sorry, Kim, did I answer your question?
And also how our listeners can get in touch with you, Michael.
Sure. Yes. So as I mentioned, I am faculty at Lodestar, and then you can also find me on my own website, betterphysicianlife.com, and I love LinkedIn, and so definitely reaching out to me there as well.
Okay, well, thank you both. This is an invaluable conversation that I hope will continue. And in closing, to move the needle in healthcare, we all need to raise our voices and we all need to care about each other. We already know that doctors need to care about patients. Patients need to care about doctors too. So stand up, doctors, and let's stand up for doctors.